right, hello everybody. Welcome to our discussion on documentation for the Pro Bono Clinic. I'm going to walk you through the documentation process as you'll experience going through your patient's care while you're in the clinic. When you pick up your packets, you'll see that this is the first page that you'll come across. This is the patient record. The top part just has some subjective information. You can include the patient's name, date of birth, if there is a referring physician, or if they're coming in direct access. This bottom half is an important piece to help you keep track of your patient's visits. You can indicate which day was the initial evaluation, depending on the month and then the day of the month that they're coming in. On the first day, you would put an E in that first section. So let's say they're coming in the third of whatever month this is. I can put an E and circle. That's going to indicate this is the date of the initial evaluation, and I'll continue to follow subsequent visits as I take them through the plan of care. If they come back in 2 days later for their second visit, I would indicate that with a 2. If they no-show or they cancel a particular visit, I can also indicate that here by either putting a cancel or no-show. Constantly monitoring when the patient's coming or when they're not coming. It would be helpful for you on the first day to also count out 30 days from this initial evaluation, and on that day put a D or a DC, indicating that within the direct access laws of 30 days in Florida, you only have 30 days after the 3rd of this month in order to complete your plan of care with this patient. That's only applicable if they are direct access. If they do have a referring physician, you're not restricted to that 30 days, and you could potentially see them beyond as needed. Whichever day you end up discharging, and it could be short of the 30 days, that will end up being documented on this particular line here. And at the conclusion, you also want to mention how many visits total were they seen. So in that case, you're not counting the cancels and no-shows. You're only including how many visits they were actually seen in the clinic for. Also helpful for us in our chart audits later on, was this a patient who was just seen for PT, or were OT and PT involved in this plan of care? When the patient first comes in, you're going to be tearing apart some of these sheets and giving them a few papers to fill out. One of these is this assumption of risk. So this is just identifying any risk involved in their plan of care. The patient themselves, they sign and date it. And then if there's a legal guardian necessary, they would have to sign and date that as well. Medical history form. This has a front and a back. The patient must complete both sides, and then once they complete both sides, they will sign and date at the bottom. While you're in the initial evaluation with them, you'll review this medical history, and your signature as the student physical therapist here indicates that you reviewed the chart with them. Any place that has your signature on it, therapist signature is you as the student therapist, we as your mentors will come in and sign behind you. Make sure on this signature and any subsequent signature that you have, you are putting your credentials as SPT, so your student physical therapist. There will also be functional index forms. So in this case, this says the upper extremity functional index. This is an extremity examination I'll take you through briefly. The lower extremity will also be available as a functional index scale. And if you're dealing in the spine, we have a neck disability index and an oswestry. So depending on which region of the body, you'll see different functional index forms available to you. You'll also see the same functional index form come up at the end of the packet, and I'll explain that when we get to that later. The last form that the patient will fill out before you start to see them is this McGill short form pain questionnaire. They can put their name and date it. They can do 3 different components here. They can indicate any of these words as relevant for their symptoms. If they do not have any of these words, they do not indicate that in the following lines. If those indicated words are present, they can indicate that as mild, moderate, and severe, and you later are going to grade it with a 1, 2, or 3. If they do not have those symptoms, it'd be graded as a 0. And at the bottom is where you're grading those. And you'll see words 1 through 11 are graded on the 0 to 3 scale. Words 12 to 15 are graded separately on the 0 to 15 scale. I'm sorry, on the 0 to 3 scale. This is a body chart so the patient can actually circle or indicate to you where on the body they are experiencing any of their symptoms, either from the anterior or the posterior side. And they have a visual analog scale where they can indicate their level of pain here at the bottom. This is your examination form. We have an extremity examination form. We also have a spine examination form and a TMJ. There's a separate neuro exam form, which does look a little bit different. But as those cases come across, make sure you take a look at that examination form accordingly. But otherwise, they will follow a typical flow. All of these are going to start with indicating which measures were recorded earlier on in the intake forms. And then it takes you through an either 18-step or modified, depending on the region of the body you're discussing, examination process. Indicate any of your initial observation, history. You in your coursework in different courses have identified ways to gather a patient's history. What we've identified for you here and including on subsequent pages helps you guide and I think gives you a pretty thorough explanation of collecting the data you may need relevant to this patient's case, including any neurological or differential diagnosis, previous medical history, any medical history that might be relevant, and symptoms relative to their functioning and how they're behaving. Systems review, this is very important. This is something in part you'll be doing every day. On the initial examination, you can include heart rate, respiratory rate, and blood pressure. In your daily notes, you won't see these listed specifically, but you'll want to take those measurements as it is good in the common practice to make sure that you're monitoring those patients' vital signs. Screening, so you can screen both the extremity above and below what you might be examining, as well as the spine, cervical, thoracic, or lumbar, whichever is relevant in that particular case. Taking them through both the dermatomes and myotomes as they may be relevant, looking at upper quarter and lower quarter assessments, and also assessing for any reflexes and any upper motor neuron signs or symptoms. Neural tensioning, also part of this, as it may be relevant for your particular case. Structural inspection, now you're starting to get into the meat of the rest of your exam. Indicate the structural inspection, palpation for condition, and some of these you're given possible options that you can check off. You also have room for comments as you may want to add any additional information. Active range of motion, and you'll see passive range of motion. In each of those sections, you're given these little charts where you can indicate what joint motion you're going through and quantity, quality, and any symptoms that might be experiencing with those motions. Your MSTT, your muscle length testing, your main muscle testing, open as far as indicating you may be looking for certain motions or certain muscles. Just indicate those muscles and indicate your relevant findings in any of these sections. Special tests, depending on the body region again, indicate any special tests, positives and negatives as they're relevant. Neurovascular assessment, palpation for tenderness, probably one of your more important steps, although it looks like it's a very small space. Which tissues are you trying to identify at this point? Indicate which tissues here are pain-provoking and which ones you think may be relevant to not include as part of your hypothesis and your treatment for this patient later on. Movement analysis, important to indicate any of the functional movements that are relevant for their functioning, and you may want to monitor as good pre and post-test measurements here. Diagnostic, if they do come in with a referral, sometimes the community dwellers do have imaging, and that can be indicated on this section. And then your evaluation, diagnosis, and prognosis. This is really relevant for what you're going to be treating. Your evaluation is now your attempt to be specific and identify how you are going to continue to present and possibly treat this patient based on their condition. Then the diagnosis and prognosis, indicating what you believe the diagnosis from a PT perspective to be, and prognosis as you've discussed in previous courses, what's their overall prognosis, and even indicate how often, frequency of treatment you may want to see them here. Once you've completed that extremity examination, should all be done while you're with that patient. You'll then move on to this next paper, which is looking at your plan of care. And basically this is in some ways mimicking the plan of care you're developing in the musculoskeletal 4 course, but modified a bit for the needs more specific to this pro bono clinic. So make sure all of these particular areas are filled in. You see the demographic information at the top, your clinical impression, just as you've identified in the rest of the course, can be given here. Same thing with the prognosis and frequency. Your impairment list, now you're teasing out each of the different individual impairments that you picked up during your physical exam. And then the very last impairment is really your functional index score. So whatever functional index score you're measuring, put that score here as the last impairment. On the back of this form, now you're creating your goals. We're not delineating short-term versus long-term goals because of the length of time you'll be in this clinic is only 3 weeks. We're really just considering the long-term goals. Again, identifying the same list of impairments and identifying a goal for each of those. And then a goal for that functional index score in that last section. Whichever impairments you identified and created goals for, now create intervention or treatment plan for each of those. It does not have to be specific, as your treatment plan can change day to day, but just give a general flow of how you might want to address any of the goals listed above. Patient-related instructions in your home exercise program, this is a good thing to include because you want to make sure that in that first day, you're identifying what can this patient work on at home, and this is where you can identify what that instruction was towards the patient. You are the therapist, so your signature would go here and we will sign again behind you. If there is a physician of record giving you a referral, this form will also be faxed to a physician, and their signature can accompany yours as well. So now your patient comes in for subsequent visits, and this is where you're going to track your daily notes. So daily progress notes. Each and every page should have the patient's name. So you'll see on each of these pages, it does say patient name. Put the patient's name on every single page. And just like we mentioned on the charts, last name first and then first name. Each day, put the date at the beginning. So today's date, and then you're gonna write your daily progress note. I think the easiest way for you to format this is in the form of a SOAP note. You could be writing a paragraph, you could be doing bullet points. I think providing a SOAP note in a bulleted format gives you the most efficient way to do your documentation. I don't want to see one daily note taking up an entire page. That would be far too much information that you might be including. So try and be efficient with your words. You want to make sure that you're mentioning everything that's important, but you also don't want to be giving too much added information and then just word vomiting on this paper. So bullet points work really well, getting concise and to the point, your subjective, objective assessment and plan. In the objective section, this is a good place where you can put what you did in the clinic with them today. And then your assessment should be a thorough assessment using your PT evaluation of what happened that day. So give us a synopsis of their response to the treatment, how they did, pre and post measurements, improvements in range of motion. What are the patient's deficits? Are they lacking because of contractile tissues, be it shortening or weakness? Are they possibly seeing motor control deficits? Whatever your assessment is of the patient today, that goes in that assessment component. Your plan is the last part of your note for the day. And I don't want you to just get in the habit of continuing a plan of care, not really an elevated thought process. I want you to identify 3 things that you want to do the next day. Maybe it's 3 things that you want to take a look at. Maybe it's 3 interventions that you want to make sure to include for the next day. whatever it might be, try to be specific so that if you weren't there the next day, maybe you were ill and your colleague had to take over, they can follow your note from the previous day, see what you did, how the patient responded, and see exactly what you were trying to accomplish the next visit. And then you will sign and date, you'll sign at the bottom of this. So once you finish your SOAP note, you will sign with your credentials, SPT, and then we will come in and sign behind you. We do have a couple of forms here in this packet, but you'll also notice there are plenty of blank forms in the cabinets if you need more. Each and every day, make sure you're also including the vital signs. So I mentioned this earlier in the examination form. You saw a specific location for the vital signs. There's not a specific location provided in these daily notes, but at the beginning of each session, make sure that you're including the vital signs at the beginning of your session and documenting those on this piece of paper. Now, once you've finished your plan of care and you've reached the last day of your treatment, you'll be giving a patient another index form. So in this case, I'd be giving the patient another upper extremity functional index. I'd have them fill this out and I could compare their score on this last day compared to the first day. And all of this is now going to get transferred onto a discharge summary. So pieces of information that need to be documented on the patient's last day are your daily note. So you're still filling out a daily note for that day. And then you're also filling out this discharge summary. Your discharge summary is really now a summary of what happened in that plan of care, including the patient's name, when they began the service with you, when this date of discharge, this really should be then this date of whichever day you're not discharging. Giving a brief summary, this is almost like an assessment or a snapshot of the entire process from day one till today. What kind of progress did you make? What are they able to do or not do? And you'll start to see those even get broken down a little bit in the next couple of sections. What specific goals were accomplished? What did you accomplish based on your development and your plan of care from the day one? Functional outcomes, this is what were you monitoring relevant to their specific functioning. What were they not able to do or able to do with pain before, and what are they able to do better now? If they didn't meet any of their goals or they did not have any functional outcome improvements, you want to indicate that in here too, and you want to mention why. So there could be cases that the patient doesn't come in or there's other life situations. Whatever the reason might be, you want to be honest and indicate that on this page. So not all patients you'll be seeing in the clinic will have positive outcomes when it comes to the goals or the functional outcomes. Your treatment and plan provided. This is just a brief explanation of what possible activities were provided during the clinic. If exercises were provided, just exercises relevant to whatever body region you were discussing. Manual therapy, brief snapshot of what manual therapy might have been provided. And so this is just a brief snapshot again of anything that might have been provided by you to the patient in any of these categories. Here you can indicate the total number of treatments, sign and date. Sign SPT, your credentials, and we will come in and sign behind you. There's also one more form that you might be coming across, and that is this audio, film, video, photo release agreement. If we are looking to include any of those media forms with this patient, we would provide this form to them, have them sign, including their signature, printing of their name. If there's a parent or legal guardian necessary, we can include that here as well. These won't necessarily be in every single patient chart, but we will have these available to you as needed. That was a quick summary of most of the documentation. You'll probably come across individual questions as your individual cases come around, so feel free to reach out to us on a case-by-case basis. But refer to this video for the meat and potatoes of how to handle the Pro Bono Clinic documentation.